Good evening. Hi, I'm Michael Kidd. I'm the Editor-in-Chief of the Journal of Medical Case Reports, and I'm sorry I can't be in London tonight for the awards, but I'm very pleased to be here on video to announce the winner of the inaugural award for the best case report from the Journal of Medical Case Reports. I'm very pleased we had a very large number of nominations. We received nominations from our readers, from authors, and also from members of our editorial board. The Journal of Medical Case Reports was launched about a year ago, and already it's been phenomenally successful. We've had a very large number of submissions and we've published over 200 case reports over the past 12 months. The journal is peer-reviewed, it's open access, and we're keen to receive and to publish manuscripts describing any case where the authors feel that reporting the case is going to make a difference to medical knowledge or contributes to the knowledge that we already have about clinical conditions. In particular, we're keen to receive case reports describing the side effects of new medications, new associations with diseases, the unexpected or unusual presentations of diseases, and also reports of new and emerging or re-emerging diseases. We have a winner and we have two runner-ups, or two runners-up, and I'm very pleased to announce that the second runner-up is a paper. First author is Amit Verma, and the paper is called Reactive Arthritis Developing After Pneumococcal Conjunctivitis, a Case Report. And this particular case report was nominated because it presents an unexpected or unusual presentation of a disease, and particularly because it involved a case where a treating clinician was infected by one of his patients and then developed unusual side effects from the original condition. So it was a very interesting case report. The first runner-up is a case, the first author is Nicholas Lefebvre, and the case report title is Minocycline-Induced Hypersensitivity Syndrome, presenting with meningitis and brain edema, a case report. This case was nominated because it is an example of an unreported or unusual side effect involving a medication. And one of the areas we're particularly keen to focus on in the journal is looking at new and unreported side effects of medications. Now, minocycline is a very common medication, but the particular side effect which this patient suffered is really quite unusual. So that was an excellent case report. The authors in this case are from France. And now, with a drum roll, the winner of the inaugural award is a paper. The first author is Fion Mai, and the case report title is A Possible New Syndrome with Growth Hormone Secreting Pituitary Adenoma, Colonic Polyposis, Lipomatosis and Renal Carcinoma in association with Familial Testicular Germ Cell Malignancy, a case report. This case was nominated by a number of individuals, and it's important because it shows a new association in a disease process. This is a description of what is possibly a new syndrome, and it's familial syndrome. And also it's interesting in that this case is a combination of both clinical observation by the treating doctors and also the use of newly available genetic testing to actually see if the clinical observations relate to a new syndrome. So it's an exciting paper. It's one of the most accessed of all papers from our journal over the past year, and I'd like to congratulate the authors on being the winners of this first inaugural award.